Are your routine health checkups after 70 actually harming you more than helping? What if some of those tests, the ones your doctor says you need, could quietly push you closer to surgery, stroke, or even cancer? There's a hidden truth about senior healthcare that most will never hear. Every year, millions of seniors blindly line up for checkups, unaware they're being overtested. New studies reveal up to 37% of medical tests in older adults lead to unnecessary treatments, complications, or lifelong side effects. Shockingly, 99% of people over 70 have no idea they're caught in this medical overtesting epidemic. The truth, buried in the science, reveals that one of these checkups, the number one on our list, causes 5% of all cancer cases in the U.S., a statistic on par with daily alcohol consumption. Today, we're uncovering all 7 health checkups you should avoid, backed by real science, and you won't believe what made it to number 2. Before we begin, tell us in the comments below, where are you watching from, your age, and have you ever regretted a test or procedure? We're reading and replying to every comment. Number 5. Bone density scan. It sounds harmless. A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. This scan, officially called a DEXA scan, measures how strong your bones are, primarily used to detect osteoporosis. For many, it seems like a smart, proactive move to stay ahead of potential issues. But here's what no one tells you about what a low-density score really means after 70. Past this age, a bone density scan can often create more fear than benefit, quietly setting off a chain reaction you might not need. The uncomfortable truth is that in older adults, especially women, the results almost always come back showing lower density, even when there's no real danger. That's because bone loss is a natural part of aging, much like wrinkles or gray hair. And yet, many seniors are pushed into taking medications like bisphosphonates, which are supposed to strengthen bones but come with serious side effects like jaw necrosis, where the jawbone starts to die, and esophageal irritation. This solution often comes with severe side effects, and studies show it barely prevents fractures. A study published in the Journal of the American Geriatric Society found bisphosphonates reduced fracture risk by only 0.3% after 5 years in women over 70. Consider Eleanor, 78, who started these medications after a DEXA scan, only to develop severe digestive issues and jaw pain, impacting her ability to eat and enjoy life. Instead of medication, for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into treatment you may not need. Prioritize movement, a calcium-rich diet, and sunshine. Next, we uncover how a common memory test can trigger unnecessary brain surgery. When seniors feel more forgetful or confused, the natural impulse is fear. Fear of dementia, fear of Alzheimer's. It's a deeply unsettling experience to notice those subtle shifts in memory. Misplacing keys more often, struggling with names that once came easily. So doctors often respond by ordering a brain MRI, a detailed scan, thinking it's a reassuring step to rule out something serious. But what if this reassuring scan only leads to more fear and unnecessary procedures? Here's the uncomfortable truth. These expensive, high-tech scans rarely give the answers patients are truly hoping for. In fact, most MRIs in people over 70 simply show age-related changes. We're talking about slight brain shrinkage or white matter spots that are totally normal in older adults. But here's the kicker. Once those spots are seen, they can trigger a cascade of fear, further tests, and even surgery. Surgery that may not improve memory and can actually make things worse. Imagine being told there's something wrong when there isn't, leading to invasive and risky procedures. A 2021 study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. A staggering 86% showed some form of brain abnormality, but but only 3% of those findings were linked to an actual treatable condition. That means 97% of people went through the emotional toll of hearing there's something wrong, when really there wasn't. Worse, nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague scan results. Take George, 74, whose MRI findings caused panic and withdrawal, convinced he had dementia when his memory was within normal age ranges. The truth is, unless there are severe neurological symptoms like seizures, sudden personality change, or rapid functional decline, an MRI is rarely helpful in mild memory loss. A better first step is a cognitive screening test, a simple paper-based exam that evaluates memory, attention, and problem-solving. It's cheap, effective, and avoids the risk of unnecessary panic. Coupled with lifestyle interventions like sleep, hydration, and brain games, many seniors find their memory stabilizes and their well-being improves. Next, we tackle a test almost everyone has that can lead to needless heart surgery. Brace yourself, because the next test is one you've probably had multiple times, and it can lead to unnecessary heart procedures. Number 3, cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue, chest tightness, or just not feeling like they used to. This procedure, which monitors your heart while walking on a treadmill or being given medication that simulates exercise, is widely believed to be a crucial step in spotting blocked arteries. It sounds like a smart, proactive move to safeguard your heart. But after 70, this seemingly routine test often does far more harm than good, especially when used on people without clear signs of heart disease. This common test, meant to protect your heart, might actually be pushing you towards unnecessary and risky procedures. The problem lies in its accuracy. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%, meaning the test indicates a problem when none truly exists. This leads to a dangerous cascade of follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit. Those patients saw no improvement in survival or quality of life after the procedure, but they did face higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. Remember Raymond, 75, who received a stent for mild narrowing and subsequently suffered kidney problems. His fatigue was never related to his heart. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity or significant shortness of breath on exertion, then a stress test may be counterproductive. A better option is often a resting EKG, which simply looks at the heart's rhythm while you're still, or even a coronary calcium scan, a low-radiation imaging test that shows whether dangerous plaque is truly building up. These are safer, simpler, and far less likely to push you into a procedure you don't need. Next, a procedure many consider essential but which poses serious risks for seniors, the colonoscopy. You probably didn't expect this one, but colonoscopy, a procedure that uses a long camera to examine your colon, is not always a wise choice after age 70 and almost never recommended after 75 unless there are specific symptoms. It's widely considered an essential screening, a vital step in detecting colon cancer early, but for seniors, the risks often far outweigh the rewards. While it sounds proactive, a routine colonoscopy, especially as we age, carries hidden dangers that are rarely discussed. You might think this is a must-do, but for seniors, the risks often far outweigh the rewards. The risks go up significantly with age. The preparation alone is harsh, involving strong laxatives that can cause severe dehydration, dizziness, or kidney issues in older adults. The sedation used during the procedure poses added risks to brain function, potentially leading to confusion or memory problems. And perhaps most surprisingly, the test itself can cause complications like bleeding, tearing, or even dangerous heart rhythm disturbances. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, Only 2 lives were saved, but over 20 people experienced serious complications. That's a staggering 10-to-1 risk-to-benefit ratio. Consider Dana, 73, who suffered a bowel perforation after a routine screening, requiring emergency surgery and a prolonged recovery. The good news is, there are safer, simpler alternatives. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, which is a non-invasive fecal test done at home, is often a much safer option. It has no prep, no sedation, and still catches most concerning cases. Ask your doctor about alternatives, because once you're in the colonoscopy pipeline, it's hard to get out. There's a simpler, safer way to screen that avoids the risks and the pipeline effect. Next, a test that can lead to unnecessary biopsies and treatments for a condition that often doesn't need intervention. Next, we delve into a test many men consider a cornerstone of preventative health, the PSA test. This simple blood test, measuring prostate-specific antigen, is widely used to screen for prostate cancer. For decades, it has been hailed as crucial for early detection, offering the promise of catching cancer before it spreads. But here's the uncomfortable truth. For men over 70, this widely recommended test can lead to a cascade of interventions for conditions that might never harm you. While seemingly beneficial, the routine PSA test often does more to spark anxiety and unnecessary procedures than to extend healthy life in older age. The core issue with routine PSA testing in older men is overdiagnosis. This refers to detecting slow-growing cancers that would likely never cause symptoms or threaten a man's life. Yet once discovered, these cancers often trigger aggressive treatments like surgery or radiation, carrying devastating side effects. Imagine millions of men being diagnosed and treated for prostate cancers that would never have threatened their lives, only to endure incontinence, erectile dysfunction, or bowel issues. Studies, including those published in the New England Journal of Medicine, have shown that for older men, routine PSA screening offers limited to no survival benefit, while significantly increasing the risk of treatment-related harm. Consider Robert, 79, whose elevated PSA led to a biopsy and subsequent treatment for a low-grade tumor, ultimately impacting his quality of life more than the cancer itself would have. So, what's the better approach? For men over 70, the answer lies in shared decision-making. It's crucial to have an informed conversation with your doctor about your personal risk factors, overall health, life expectancy, and individual preferences. For some high-risk individuals, targeted screening might still be appropriate, but routine testing for all is being reconsidered. Empower yourself to weigh the potential benefits against the very real harms. Don't let a number dictate your quality of life. Now, brace yourself, because next we tackle a common blood test for a seemingly simple condition that can lead to dangerously tight control and unexpected, life-threatening complications. A routine blood test for blood sugar might be pushing you into a dangerous zone for seniors. Next on our list, a common blood test for a seemingly simple condition that can lead to dangerously tight control and unexpected complications. The routine A1C screening. This test, often hailed as the, quote, standard, measures your average blood sugar over the past 2 to 3 months. It's crucial for many, offering a clear picture of diabetes management. But for older adults, especially those over 70, this pursuit of an ideal number can become dangerous. While crucial for some, aggressively targeting normal blood sugar in seniors can trigger life-threatening falls and hospitalizations. Is tighter control always better for seniors? The answer, shockingly, is often no. Here's the uncomfortable truth. Aggressively managing blood sugar to hit very low A1C targets in seniors significantly increases the risk of severe hypoglycemia, dangerously low blood sugar. This can lead to confusion, dizziness, falls, fractures, and even emergency hospitalizations. Studies published in the New England Journal of Medicine have shown that for older, frail adults, aiming for very tight A1C targets offers no mortality benefit, and in fact, increases the risk of harm. Imagine Martha, 81, whose doctor pushed for aggressive A1C control. Despite feeling well, her medication regimen was intensified. This led to a severe hypoglycemic episode, a fall, and ultimately a broken hip. Studies show that aiming for perfect blood sugar in seniors not only offers no benefit, but significantly increases risks of falls and death. Instead of chasing a universal A1C number, a more holistic approach is vital for seniors. This means emphasizing individualized A1C goals based on overall health, frailty, and life expectancy. The focus should shift to avoiding the symptoms of dangerously high or low blood sugar, not just strict numerical targets. Lifestyle interventions like a balanced diet, moderate exercise, and proper hydration remain paramount. Get ready, because we've saved the most overused, most dangerous, and most harmful checkup for last, and you've almost certainly had it done. Get ready, because the number one test on our list is shockingly common and could be causing 5% of all cancers. We have reached the most overused, most dangerous, and most harmful checkup for seniors, and you've almost certainly had it done. Full-body CT scans, sometimes offered as part of luxurious executive health packages or marketed as the ultimate preventative service in private clinics, promise to catch cancer early. The allure is undeniable, an all-seeing scan to find trouble before it starts. But here's the shocking truth. This isn't a safeguard. For older adults, it's the most overused, most dangerous, and most harmful checkup, a true medical gamble. This preventative scan, which you've almost certainly had, could be actively giving you cancer. The irony is stark, and the risk is terrifying. These scans expose your body to a high dose of ionizing radiation. Each full-body scan delivers between 10 to 20 millisieverts of radiation, equivalent to around 500 chest X-rays. According to a groundbreaking 2023 modeling study published in JAMA Internal Medicine, the alarming rise in CT scans across the United States may now be directly responsible for up to 5% of all cancers, placing them on par with daily alcohol consumption as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scan can detect countless harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they are seen, a red flag goes up, triggering a cascade of more scans, then biopsies, then sheer panic. Consider Marcus, an active 80-year-old who felt great but underwent a senior elite checkup. His full-body scan showed a tiny 3 mm nodule. This innocuous finding set off a chain reaction, oncology referrals, a PET scan, and eventually a needle biopsy. The result was benign, but the biopsy collapsed part of his lung, leading to hospitalization and 2 months of recovery. All for something that could and should have been left alone. Experts now unequivocally advise that full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and significant potential for harm. If there are genuine symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes perfect sense. But scanning the entire body with no specific focus is like searching for treasure with a landmine detector. You may find something, but the damage could be worse than what you were trying to avoid. The experts agree. These scans offer no benefit for healthy adults, only significant potential for harm. Choose wisely. We have journeyed through the unseen dangers lurking in routine healthcare for seniors. We've uncovered how seemingly harmless procedures like bone density scans can lead to unnecessary medication, how brain MRIs for mild forgetfulness can trigger cascades of fear and invasive tests, and how cardiac stress tests can push you towards risky, unneeded heart procedures. We've pulled back the curtain on the digestive dilemma of routine colonoscopies, the prostate paradox of PSA testing, and the sugar scan shadow of aggressive A1C management, all leading to more harm than help. And finally, we revealed the radiation roulette of annual full-body CT scans, a silent culprit contributing to cancer. Modern medicine is powerful, but it's not perfect. Sometimes, especially as we age, less is truly more. Your time, energy, and health are too valuable to waste on fear-driven screenings that could leave you worse than where you started. Always ask, what happens next? If the answer is unclear, or if the risks outweigh the reward, it may be time to pause. Remember, real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share with us your experiences and opinions in the comments below. We're reading and replying to every single comment with personalized tips and advice, fostering a community where knowledge empowers. Your story could be the hidden truth someone else desperately needs to hear. Don't forget to like this video and subscribe to our channel for more crucial, life-saving information and empowering health insights. Your voice matters, and your choice can make all the difference. Thanks for watching.